Yeah, this is also very fascinating because one of the biggest challenges I have as a physician is when the patient comes into the office and their blood pressure is elevated, and then they say, "Oh, Dr. Kohli, I promise it's normal at home, and here's my blood pressure log," and then I'm left scratching my head. Is it just white coat hypertension, or is there actually under detection of high blood pressure at home? And sometimes the opposite, what we call masked hypertension, where they're normal in the office, but they actually end up running high at home. So I think wearables are the future. I really do. Having said that, I do think the technology needs to be validated. So for now, I'm mostly relying on my patients to use the arm cuff, which is the one that we know performs the best with the least amount of variability. Sometimes patients come in with a wrist cuff or a watch, for example, that squeezes and basically determines your blood pressure based on the traditional way, but on the wrist, that is more prone to noise, especially if they have small wrists or large wrists, or if they move their hand or what have you. So I rely less on that. But the newest technology, which I think is really interesting, is something called reflective photoplethysmography, which is actually like a patch, a sticker, just like a Zeo patch or a Holter monitor that you would wear, that would check your blood pressure along with other vital signs such as your pulse oximetry, your heart rate, and even measures like stroke volume and cardiac output can actually be detected with this based on this reflective photoplethysmography. So I think it's a really cool technology. I think it has tremendous potential because just imagine if I could put a patch on my patient for a whole day or a whole week or 2 weeks and have it kind of continuously sort of assessing the blood pressure and getting an accurate read. But it still needs a bit of validation, in my opinion, before I start to really titrate my medications based on that. I'm just excited that that's where the future is headed, because if this technology is validated, you could start to think about less invasive ways to check your blood pressure. Because even the process of checking our blood pressure, which squeezes our arms, in some patients can actually raise their blood pressure, because it causes a little bit of pain and sympathetic activation when you're actually checking the blood pressure. So stay tuned. I think it's coming, and I think it holds a lot of promise. I think, the potential is so tremendous for AI to make us better clinicians, to make us better at screening patients for hypertension, even potentially to empower patients, pharmacists, nurse practitioners, and the rest of the healthcare team to more aggressively titrate blood pressure medications. And so I see a few sort of potential applications. The first is to help in detection, right? And so there are, hundreds and thousands of patients that go through primary care every day, and really understanding if they've had a repetitive trend with multiple readings of stage 1 hypertension with blood pressures over 130/80, or if they have other sort of comorbidities that might suggest hypercortisolism or some other diagnosis as well. AI could definitely help us be better at sort of diagnosing, detecting, and really understanding that this patient didn't just have a high blood pressure today because the parking lot was full, but they've actually had a high blood pressure many times before, and they actually do have stage 1 hypertension. So I think diagnosis with AI is going to be tremendous. But what I'm really optimistic about is AI helping me to better understand perhaps which medications I should use for a patient based on their risk factor profile, their age, their comorbidities, their history of side effects, their medication intolerances. Because right now it's sort of a free-for-all, right? We have a choice between ARBs and ACEs or calcium channel blockers or thiazide diuretics as our first choice. And we just pick, we randomly pick. So if AI could help to direct me based on the patient's risk factor profile, based on the fact that they've had edema before with other medicines, based on the fact that they tend to be more hyponatremic, they're a little bit older, that would be a tremendous application as well. So I think AI in hypertension is something that I'm actually very excited about, especially with the interface of those wearables, as we discussed. If the AI could actually become the monitor that looks at this chronic disease management, because I know a lot of practices have RCM programs where they look at chronic disease management and titrate blood pressure medicines. But if AI could make us more efficient with that, then it really has a role not just in diagnosis, not just in selecting the treatment, but even in ongoing titration and management of the treatment. So I'm very excited about that potential. I also think from a research perspective, we don't completely understand hypertension. And there's an emerging body of literature that our gut microbiome and the types of bile acids that we have determine our blood pressure. And that could be one of the reasons why we're seeing more hypertension now than ever before. Of course, the sodium in our food, but even the processed foods change the way that our gut microbiome looks. So by altering that back in a positive direction? Can we actually think about treating hypertension using different mechanisms, not just RAS and the endothelin receptors and the other receptors on the blood vessels, but actually thinking about if the gut could be involved in regulating our hypertension beyond just a sodium intake? How could that look for our patients as well?